The countdown has just started. Cardiology comes to Munich. From the 28th to the 31st of August, 30,000 colleagues from over 150 countries will attend ESC Congress. More than 2,000 faculty from 80 countries, and one purpose: turning innovative ideas into clinical reality. On behalf of the Congress Program Committee, which I have the honor to chair, I am delighted to invite you to 4 extraordinary days of pioneering science, practical learning, and invaluable exchange with colleagues from all around the world. First, how the program was built. Then, what I would not miss. At the ESC, we know very well that evidence changes practice when it's questioned and when it's discussed, not just when it's announced. That's why every major session invites your participation and debate. And because progress happens across disciplines, our program brings cardiology subspecialties together to learn and to collaborate. 12 hotline sessions, carrying 59 clinical trials, and all of them practice-changing. The largest number in the history of the Congress. Examples include Librexia ACS in acute coronary syndromes, Precise MI ruling out infarction in emergency departments, Acacia HCM in non-obstructive hypertrophic cardiomyopathy, CardioTransform in amyloid cardiomyopathy. And finally, STAR-E, statins in healthy adults over 70. All important questions, and just a teaser of large number of hotlines for you to attend. You will hear these results before you read them anywhere. And in the Ask the Trialist, you put your question to the investigator, not to just somebody who's summarizing the results. In the late-breaking science, major findings reach the world for the first time. Then, more than 5,500 abstracts. Today's posters and these presentations are the next decade's hotlines. They're waiting for someone to ask a good question, and that should be you. In the expanded e-poster discussions, the science is close enough for you to question it. Finally, 3 new ESC guidelines: heart failure, cardiac rehabilitation, and cardiovascular disease in chronic kidney disease. And together with the American College of Cardiology, the American Heart Association, and the World Heart Federation, we will announce the 5th universal definition of myocardial infarction. All these will be published simultaneously in the European Heart Journal and explained in Munich by people who wrote them. Our spotlight this year is artificial intelligence, but not as a future promise, as actually a co-pilot already at work in our clinic, in ECG interpretation, in imaging, in risk prediction, but with the key message that a co-pilot still needs a pilot, a physician. That is not a caveat. It is a clinical question how to use it and implement in our everyday practice, and we will put this question under pressure. In the AI in practice, the tools will be in your hands, not just on slides. In digital cardiology track, we ask what is reliable, what is safe, and what works on Monday morning in the hospital. Finally, in the ESC Heart Team Challenge, a new format, all specialties will come together to solve real cases. The room will be watching, and the disagreement will be alive. These formats are experiments. If they work, they should stay, and that is up to you to tell us. And whether you are a nurse, an allied professional, a cardiologist, a trainee, or patient advocate, there is a track built for you, not just around you. This is where cardiology decides what it does next. Do not read about it afterwards. Be present in the room, in Munich or online. I look forward to welcoming you. See you at the ESC Congress 2026.